Oh. Mm, mm, mm. What's happening?
What's happening, Doc P?
Nothing.
Nothing at all. It's not busy tonight.
Uh, no, it ain't bad tonight. Just been a busy couple of weeks, but it's been all right.
Yeah, I can definitely relate to that. Good evening from St. Martin. Hello, hello.
Yeah, people calling from everywhere now.
That's good, right? Or no?
That's good. That's good. I call and I beckon and they come.
Yeah. That's
Um,
that's see, you saving all heroes wear cape. Don't wear capes. Some of them wear white coats.
yeah, this shit get kind of crazy now though. They start, like people starting to put your case to shame. Like it's getting bad.
Well, what did I always tell you? I was like, you talking about me today, but I promise you, I'm opening the door for somebody who is waiting even longer than me.
Yeah,
I'm not the only person that had fears.
it's getting kind of bad now. I'm like, damn. I'm like, jeez. All right, that's cool. I mean,
Well, you
it's
said you was the slayer,
damn.
so
No,
you,
they put me to the test though. It's for real put me to the test. Like you said, because I'm sticking to absolutely no open hysterectomies. No vertical incisions or whatever. Man, they pushing all that to the limits. So, but I'm committed to it. So
I know you are.
yeah,
That's why you're the perfect person for the
yeah.
job. Sometimes you know your calling. If
Man,
you got me to lay on the table, I'm telling you,
it's getting
I'm
it's
probably
getting real
the
though,
most
because like
hesitant for any procedure out there.
it's getting real. I'm getting into like some of these cases now. I'm like, damn. Asking myself like, damn, you gotta figure this shit out, what? Um, but it's cool though. I enjoy it though. I actually enjoy it, so it's cool.
Oh, that's good. That means the mission is a success, or the mission continues to be a success.
It is.
And this is
Is.
why this is needed, I guess.
This is needed. This is needed. So I don't, they finding it. They finding the stuff. So it's cool.
That's
What
when
it's meant to
social
do.
media can be a
For
beautiful
sure.
thing.
Sure. For sure. All right, let's get to
All
it.
right. Hello, everyone. Welcome. If this is your first time joining, welcome to our monthly live Q&A with Dr. Johnson. I am one of his patients, one of his many patients that underwent treatment for advanced fibroid disease. So I shared my journey across social media, and ever since, the response was overwhelming. There were so many people that could relate to my story. So people had a lot of questions and was like, can you ask your doctor this? Because he sounds like he know what he's talking about. And it turned into a monthly series. So if you're joining tonight, you have a couple ways that you can ask your question. You can put it in the question bubble with a question mark. You're more than welcome to type on the screen hi and talk to people, but if you have a question, please put it in the question box, because that allows me to keep track of them, and it allows me to screenshot anything we don't get to, because sometimes Instagram do cut us off. If you submitted a question already, yes, I have you on the list. And also, one of our newer options is you can actually send a request to Dr. Johnson to actually join the live, and you get free game and a consultation on the spot.
That's simple.
Anything else you want to add that I missed?
Nah, that's it. It's, everybody send me these DMs and these questions. Like, this is one thing about it. It's like, and again, I don't do this for clickbait and following, but for education. So like I talk a lot about, questions and stuff that you all have, and I'm very comprehensive during these conversations so that the information is out there. So if I talk about this stuff for an hour and a half, 2 hours, and then you come back and just ask me the same question, don't get mad if I'm like, just go back to the live and just listen to the live, right? Because it's difficult to like do all of this stuff. Like everybody's coming to get surgeries. I'm like super busy, which is cool. Like that's what I'm signed up for. But putting this information out there so that like it's out there. Like, so please utilize it. I don't like to talk about stuff a million times, but I'll talk about it everything on the lives. Like if I have repeat questions on the live, I'm putting it out there. So, please just watch and share it. With that being said,
yeah, and also if you hear your question is changed a little bit, that means multiple people ask a question similar to yours. So I concise it, or I make it more universal, so everybody's question can kind of get answered in one. But if you have specific details to add, please come join us, because that might be critical to your version of the question. All right, so I'm going to kick it off tonight with a submitted question. Oh, and also number one question I got asked this month: what types of questions can you ask? We answer women's health, men's health, sexual health. Even though he's a gynecologist, he will talk about whatever. And if he doesn't know the answer, he'll tell you a good way to get the answer. So you are welcome to submit questions from all over, even questions about your children's health. We definitely had someone ask before about certain vaccines for their children. So if it's a health question, this is your opportunity to submit that type of question. So I want to kick it off with that, because a couple of people did ask, what types of questions can they submit?
Yeah, you can ask, man. You can ask anything. Like, my funded knowledge is pretty vast. Like, I can't get into a lot of specifics, like with, like, say for instance, you have some rare disease in GI or something or whatever. I won't get into that, but for the most part, if you have a question in any discipline, I can pretty much answer it. And if not, I'm not gonna fluff you and lie to you. Like, I'll get the answer for you, and we could talk offline on it. But it's more so to general knowledge. Like, if you have a question, talk about it. It's focused on gynecology and women's health and fibroids. That's what I do. But if it's pressing questions or what have you, feel free to ask. I answer that I can.
All right. Okay. So.
And bigger point of, sorry, Cola.
No,
The
you
bigger
good.
point of this entire interaction is for you all to ask Cola questions too, because I could talk to you so much about the physiology, anatomy, and all that stuff around like medical medicine, fibroids, and all those things. But the actual personal experience of somebody that has done it, been through it, had fears, went through the entire process, post-op, all of those things. Like, I can't tell you about vaginal wetness after hysterectomy. I can't tell you about how you feel going through the process of hysterectomy. I can't tell you. I can tell you how it happens and what I do, but the point and the dynamic of me and her here is so that you can actually get the patient perspective and somebody who's been through the entire process, researched and journey. So please feel free to ask her questions. I welcome questions from me, but also ask her questions as well, because sometimes y'all come around and ask me questions and I'm like, y'all need to ask Cola that stuff, because you're right. I'm not a woman. I am the doctor, but you have to ask the woman who's been through it some of these questions too.
Yeah. So yeah, you can definitely, I know I do answer questions when people DM me, and I try to pick out ones that people ask a lot and bring them here. But also, with that being said, about asking questions, is my case also was an extreme case, like he liked to emphasize on a regular basis. So if my case definitely can answer a lot, because I went through pretty much, I suffered for a long time. I'll just say it like that.
So I got two questions, and you want me to start with these questions that people ask, or you want to go with your questions? How you want to
Oh,
go?
you can start.
All right. So the first question was, how much is fibroid surgery? Okay. And I'm gonna go into this again, and Cola will tell you. There are many things that I do in my life to bring revenue for myself. Operating really is not one of them, right? I honestly do this for the love of helping people, because when it comes down to it, me personally, you would be shocked, because I am the reason that it's happening. I am performing the surgery, but I am the lowest person on the totem pole that's actually getting paid from the surgery. Everybody gets paid more for the actual surgery than me. So when people say, "Oh, you just going in there, you just want to take out women's because you want to get paid," it's false. I get paid more for teaching. I get paid more for other things that I do other than actually doing the actual surgery. It is a small percentage of it. So let's say, for instance, and the only reason I know this because I had a woman call from Canada that wanted to come in, and clearly she didn't have surgery. This was like 2 years ago, and she wanted to know the cost breakdown for a myomectomy. Now, I don't know the cost breakdown for everything, but I specifically remember the myomectomy cost, and it was in the between 20 and 22,000, I believe, for it. And now that includes the surgery, the well, now it does include the surgery because I don't think my fee was included, but it included the hospital fee, the hospital stay, anesthesia, and all of that stuff. So really, you can look between about 20 to 25,000. Out of that, I get a couple of $1,000s. That's it. If you have great insurance, it might be like 3 or 4. If you have public aid, it's gonna be like 1,500 or 1,000 max. That's what I'm getting from it, right? And I'm being transparent in it because I'm being transparent in it so you can understand that when someone is committed to helping you, take out of the fact that, or take out of your mind that they're in there for money. Because I promise you, there's so many other things I could do to make money than this. It's strictly for the love. But if you really want to know out of pocket what it is, it's really about 20 to 25,000 for an abdominal myomectomy, and I think maybe a robotic hysterectomy is probably going to be in that same ballpark because hospital stay and all of that stuff. Now, when you
no, mine 6 figures.
Right.
6 figures.
What the reason why yours is, and in fairness, the reason why that is because you had insurance.
Oh, okay.
So when you don't have insurance, and this is stuff that I learned, when you don't have the insurance and you're paying out of pocket, the hospital automatically has to cut 40% off of the cost.
Okay, so you're talking about non-insured.
Right. So when you're non-insured and you're paying this strictly out of pocket, this is the price I'm talking about. Now, when you are insured and they bill your insurance, you're talking about 6 figures. And in your case, where you had to have like blood and other stuff, or what have you, it just ching, 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 wrap the cost up. Right. So you probably.
And I still saw on the bill,
3,000
went to you. So out of all the 6 figures.
After all of that, about 3,000.
I still saw that.
And so
everybody else got more.
Correct.
All the other
everybody, even anesthesia.
Yeah.
Like they got, like everybody does. It is what it is. I mean, I can't really cry about it. Like it just, it's what I've been called to do and what I'm chosen to do. But, with that being said, like keep in mind, like when you going off on staff and when you going off on me or my staff or office or what have you, that your insurance really ain't paying us that much, right? So we're really here trying to help you. So it's not, for me personally, I'm not gonna take too much craziness, like, because I done had some patients call up talking like super reckless and crazy, not understanding that like literally Tuesday I had 2 surgeries. I was in the hospital from 9 to 8 p.m. 9 a.m. to 8 p.m. doing surgeries, difficult cases. Woke up Wednesday, all day surgery, crazy surgeries, on call. Thursday today, more surgeries, on call. Like this is my life, so it's like I'm really trying to help people, but realize the cost thing, whatever, it ain't that. But in answer to the question directly, it is literally, if you're straight out of pocket, anywhere from about $20,000 to $25,000.
And with insurance out of pocket, that is going to depend on
60.
Your own personal deductible, annual deductible.
Right.
So out of pocket, I still had to come up with maybe 600 or 800 or something. I don't remember. But whatever the case was, the hospital put you on a payment plan because they don't want to let that insurance money get away. So I think I was paying $100, and I was using my FA's, my whatever health spending, breaking it up. So
the next question I got was, are these surgeries bloodless? Absolutely not. And I just got into this actually conversation because I had this purely ignorant anesthesiologist that was mad or upset because of the significant blood loss. So I had a patient that um, who you guys will see because she's going to do her own post or what have you. She's actually just completed surgery not too long ago, but super difficult case. She had history of abdominal surgery, vertical incision from previous things that she's had done. Had complications in the case, and then she had a 40-week, literally 40-week size uterus. So when I put my cameras in, just like yours, when I put my camera, my instruments in, I had no room. It was all fibroid. Her entire belly, entire pelvis was all fibroid. I had to get through all of that just to get it out, right? And so with that being said, people have to realize, like, all of those fibroids, all that stuff, it has a blood supply. Like, blood is coming to that. Not to mention, when you have 6 or 7 pounds of a mass, it has blood within that too. So the tissue shift, the blood volume shift is going to be massive. So it's going to be hard. It's difficult to kind of control it, but at the end of the day, you're removing that for a better life, better future. But yes, it's a lot of blood. It's a lot of it's difficult. But with that being said, doing it minimally invasive allows you to get out of the hospital quicker, allows you to recover quicker, less pain, less infection. It's just benefits completely to the patient. So you can lose with a myomectomy. Myomectomies are going to be more bloody because you're actually removing fibroids out of the uterus, as opposed to hysterectomies, where you're just taking the uterus out, where it's going to be less blood flow. Each case is really different, and it really kind of depends on how big the fibroids are and how massive things are. So blood loss varies on the size, the complexity, and how you do the surgery. So it's a difficult question to ask, but it's definitely not a bloodless procedure. It is a lot of blood involved in the surgery.
All right. Next. So what they say, are you trying to preserve uterus? So that's if you're getting a myomectomy that preserves your uterus. Is there a connection between fibroids and goiters?
Goiters?
Okay. Hypothetically, is surgery recommended for a goiter 3.5 centimeters?
So that's a more specific and difficult question. So goiters are disorders of the thyroid or disease of the thyroid, and goiters just really depending on if they're cancerous or like what the cause of the source of them are, where they can be treated versus treated medically versus treated surgically. So that's a specific, very specific question. It doesn't have a very specific answer. Each case with the goiter is different. I will say that goiters really intuitively are not directly correlated with fibroids. They're two separate entities. One's dependent on thyroid hormone. The other one is dependent on your ovarian hormones. Now, with that being said, you do have cross reactivity because thyroid hormone is what, and the hormones that stimulate the ovaries do come from the same place in the brain. But as far as them pathologically being similar or having a direct correlation, no. I have people that have goiters with no fibroids, and people will have big fibroids and absolutely no goiter. So it's not a direct correlation between the two.
All right. Next question. Are there exercises that can be done to make vaginal delivery smoother or easier?
Absolutely. Hear this. So that's a phenomenal question, whoever asked that question. As far as vaginal deliveries are concerned, right? This is what I talk to my patients about and what I recommend for every woman. A couple of misconceptions is that you can't really exercise or move in pregnancy. That is so false. It's the biggest myth and misconception. You should be exercising, you should be moving, you should be super active during pregnancy, in addition to doing a lot of stretching. So stretching helps a ton. If you could pick up a yoga class, if you could stretch your thighs, if you could stretch your hip, your back, especially my first time moms, like, realize the baby is going to stretch you. So either you're going to stretch to accommodate this stretching, or you're going to allow the baby to physiologically stretch things that have never been stretched like that before. It's your choice. If you don't do it, it's going to happen. And if it's just going to happen without you accommodating, it can be very painful. So stretching is key. I would do stretching at least 4 to 5 times a week, if not every single day. In addition, perineal massage, right? So the perineum is, if you would, I'm going to be very blunt about where it's at. The perineum is between the vagina and the anus, right? That little strip of tissue between the vagina and the anus. When you talk about when you talk about tears from delivery or whatever, it typically happens right there. That is the part that's most vulnerable to tearing. So one thing that you can do is just take some oils, baby oil gel, any type of gels or oils and lubricants, and massage that area, or have your partner massage that area, stretch down on your vagina, do stretching exercises on your lower part of your vagina, as well as your perineum, massaging that area throughout pregnancy. This will help you a ton. My sister, I have my sister, and I talked to my sister through all of this stuff, who did that and had no tears. These things should be also done while you're delivering. Like, your doctor should be putting warm compresses on the perineum, should be stretching the perineum. And when you're delivering, while everybody in the room is talking about push, 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 and you just push and push and push, and to blow the baby out, that's how tears happen, right? It should be a controlled environment, to where when the baby starts to crown, you should start to slow down, and the physician should allow a proper descent, which will decrease the amount of tearing. Since I've been in practice, I have not had any 4th degree lacerations. 4th degree, so let me go over definitions, right? So people wonder, like, what is 1st degree, 2nd degree, 3rd degree? So a 4th degree tear, which is the worst possible tear that you can have with vaginal delivery, means that the tear, and sorry, this is graphic, but the tear goes through the vagina, through the perineum, and to your anus, right? To the asshole. It rips the asshole. That is a 4th degree tear. To date, I have 0 of these. A 3rd degree tear is, it goes through the vagina, through that perineum, and then there's a sphincter around your anus. There's an internal sphincter, and then there's an external sphincter. The 3rd degree tear is a partial tear of that external sphincter, which is not to the asshole, but damn close. It's where the muscles control your asshole. But those are bad, but not that bad. To date, in my 10-year career, I believe I've had 3 or 4, maybe, of those. Everything else has been 1st degree and 2nd degree. 2nd degree is just down to the muscle of the perineum. The 1st degree is just the mucosa, or just the vaginal lining, not really much. Sometimes doesn't even need a stitch. If you want the best way and method to not experience 3rd and 4th degree lacerations, your doctor needs to control the rate of descent of the head, because when the head gets to the vagina, if you're not stretching and you just allow to push, and you just blow it, because the head's going to come. Once the head comes, everything else just follows. You have to control that. It has to be an accommodation coming out, because you got to think of it like, I can't even think of a good analogy. But like, if you're pulling or ripping something out, if you allow something to stretch while you're pulling it and you do it slowly, it's not a grip. But if you just, it's just going to just make its own path. And that's really what's happening. you have to really, 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 really control it. And again, women who exercise regularly, who eat proper diet, so diet and exercise, who stretch and do perineal massage, have easier deliveries, they don't tear much, and they have much, much, much more comfortable pregnancies and healthier deliveries, and even more importantly, have the bounce back, right? How these women come back like 3 months, 2 months, 4 months. You see Beyonce, you see all of these women that have babies and then come back like ain't nothing happened. It's because they had trainers and they were training like when they were pregnant, when they're not pregnant. So you have to take pregnancy very seriously. It is not a free pass for you to eat whatever you want and just do nothing or do whatever you want. It is literally a time where you have to even focus more on your body to accommodate the things that are going on inside and the physiologic changes, and to get ready for the biggest exercise of your life, which is delivery. All right, that's it.
Definitely is a big exercise.
Yeah.
He done made my blood pressure go up just a little bit. That's why I'm done.
Oh, shit.
All right. I have heard that Black men also can get breast cancer, and men in general, when they get breast cancer, have less chance of recovery. Is this true?
Big facts. That is a fact. A couple of things. When men can get breast cancer. It is rare, but men can get breast cancer, and if they do, it is very aggressive. The bigger thing too is if you are a woman and you have a man that has had breast cancer in your family, you definitely need to go get checked for BRCA. Because it's so rare for men to get it, it is usually likely that the man has a BRCA gene, and that BRCA gene may be prevalent in the family. So be on the lookout, ladies, if you hear that there's a male in your family with breast cancer, to, go get tested and checked out.
All right. I need some water because that tearing boy. Right. Oh, the memories. All right. How do I make an appointment? P, can you put your phone number pinned on the comments at one of the comments? We're going to have him pin his phone number to the information. I mean, it's in his bio as well, but we'll have him pin his information.
Right now. All right, what's the next question?
All right. Are there surgeries for bladder leaks?
There are surgery for bladder leaks. So what you're talking about is incontinence. So let me talk about finish this real quick. Incontinence real quick. So there's two types of incontinence. One is stress. Damn, I didn't mean that. I meant to pin that. God dog it. Pin comment. There you go. And then 773.
It's only gonna let you do one or the other. So
I'll pin this one.
Okay. Because I was gonna say I noticed that in the last time. It overrides it when you.
So two types of incontinence: stress and urge, right? So urge incontinence is when you feel like you got to go to the bathroom, or maybe you don't feel like you got to go to the bathroom, and you just go, and you cannot make it to the bathroom, right? It means you lose urine, and you're not able to get to the bathroom. You'll feel an urge, and you just can't get there, right? That's urge incontinence. The other incontinence is stress incontinence. Stress incontinence is laugh, cough, sneeze, lose urine. So you're in the room, you're talking big, somebody say something funny, you start laughing, you lose urine that way. Those are the two types. You can have a mixture of them. You can have a mixture of urge and stress incontinence, which is called mixed incontinence. The biggest difference between the two is one can be fixed with medication or treated with medication. The other one is a surgical, or there are some non-surgical options, but permanent fixes are surgical options. So urge incontinence, when you feel the urge to go, but you cannot make it, is usually from the bladder spasming. And typically, a lot of times it's a byproduct of what we intake. So bladder irritants are caffeine, spicy foods. Those things can irritate the bladder and can make it to the point where you are not able to control your urine. So sometimes it's as simple as a fix or a correction of your diet. Other than that, it's medication. It's medications that's specifically designed to relax the involuntary muscles of the bladder to prevent you from losing your urine before you're able to go. Stress incontinence is different. So stress incontinence is your urethra. So you have your bladder, and your urethra is the tube that goes from your bladder out, small, where you pee from. For women, it's really, really short. And with that being said, there's a shelf that's underneath the urethra of muscle and tissue, fibrous tissue, that keeps that urethra up. When you have things like, well, vaginal deliveries, chronic lifting, coughing, things over time, some women who also have genetic predisposition as well, can have some breakdown or some weakness in that layer that holds up the urethra. And so with that being said, the urethra will kink. And if the urethra kinks, when you laugh, cough, sneeze, it'll straighten. You can lose urine, it'll kink back again. And so for that, you have to recreate or restructure the shelf up underneath the urethra, bringing it upright and supporting it so that you can now hold urine on your own. So those are the two types. And it really, you have to diagnose specifically what you have first, whether it's a mixed incontinence, whether it's just stress, whether it's just urge, and then you can offer treatments appropriately. Stress incontinence can also be treated with pessaries or vaginal or vagina space filling devices. For older women that really don't want surgery, there's different options, but first you got to figure out, what it's coming from or what the problem is.
All right. So if you just joined, you are more than welcome to pop in a question. Please use the question mark with the bubble around it to drop your questions. And then also, if you would like to join the live in person, you can send Dr. Johnson a request and he will let you hop in the live. So I see people have some questions in here for me. All right. So first one, how was your vagina after? I like how things work now. So that's an excellent question. I personally do not have any difference in my vagina pre-surgery to my vagina post-surgery. So you you're definitely gonna have to wait to have sex after the procedure. In my case, I had a hysterectomy, so I had to wait to be sexually active. So, man might be like, what your mouth gonna do in the meantime, whatever. But you're gonna have to wait. But my vagina is not different in my opinion. I probably could not get my husband to join, so he won't be able to ask him, but it's no difference for me at all.
Said, should I leave?
Hi, son. How you doing? But yeah, it's no difference for me. So I think you will be fine. I think that would be definitely, it was more traumatic trying to have sex with fibroids than it is to have sex without fibroids, if that makes sense.
So next question.
All right. Next question, and this one also is, I think, for me. Do you have any advice on preparing pre and post hysterectomy surgery? What items helped you through? So advice for pre-surgery. So definitely, Dr. Johnson was like, make sure you continuing to eat right. Make sure you continuing to do your water intake. Like, don't do any drastic changes with your diet. I didn't have to decrease like my normal physical activity in prepping for surgery. The number one thing that I will say though, and many of you that have DM'd me, I have told you this, and this is my experience with Black people, so I ain't trying to be racist. For whatever reason, we hate medicine. So Dr. Johnson clearly told me, I'm going to prescribe you stool softeners, pain medication, and one more thing or whatever. I decided not to take the stool softeners in my own. I said no because it's just like, oh, I don't need that. I know he said it. Even though he's a doctor, I'm like, he don't know what he's talking about. And my first post I visit, I hit a hemorrhoid that was so bad, my blood pressure was up. And I started taking them. But he was like, because the first question he asked was, did you take the stool softeners that I prescribed? And I was like, no, I don't think I really needed them. I mean, I'm regular. I drink enough water. I don't really eat foods that back me up. And he was like, it's different when you have surgery. So he was absolutely right. I don't care if they give you over the counter. It's not the same as the ones that they prescribe. And I'm telling everybody now, take the medicine that they give you to go home with, no matter how much you hate popping pills. Please, 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 please. That's the best thing I can definitely say. Anything else you can think of that you told me to prep him for surgery?
Just listen. As far as, like, and this goes with any surgery, like with anything, like you want to be in your best health. Like you want to be eating properly. You want to be drinking a lot of fluids. You want you want your health to be optimized, which is going to, make surgery better for you as well as your recovery better and decrease the amount of complications, right? If you are just eating horrible, have a horrible diet, you can't expect it to bounce back like that. Like your body gives you what you give it, so try to be as healthy as humanly possible, especially like substances we put in our bodies, smoke, drinking alcohol, like all of those things really play a big part when it comes to your healing and your recovery. So be very cognizant about that.
Yeah, and just listen to your body. So like I didn't rush back to work. I definitely took naps throughout the day. I wasn't in a whole lot of pain though. So the pain medication is on an as need basis. I didn't have a lot of pain, so I definitely didn't take a lot of those. But I don't care. Take the stool softeners. Please take the stool softeners. Don't take over the counter. Take the ones they prescribed you. I will definitely say that till I'm blue in the face.
So you got another question? I got some more questions in here.
Okay, go ahead.
So the next question is, do I do surgery for blocked fallopian tubes? The answer to that is no, I don't. And I'll tell you why. And not many people do, because when you have blocked fallopian tubes, either A, they were surgically blocked, whether you had like, a tubal of some sort or a tubal interruption, or they're blocked because of fluid, which is called hydrosalpinx. When you have physiologic fluid in your tube, you can clear it, but that fluid usually reaccumulates. That fluid is embryotoxic, meaning that when you get pregnant, it actually hinders pregnancy. So if you go to a fertility specialist, they will recommend removing the tube if you have fluid blocked in your tubes. If you have had a scar tissue or have had your tubes tied, meaning some device placed on your tube to interrupt it. If you try to reconstruct or reconnect, the success rate of that is less than 15%. So it's even a higher chance that you have an ectopic pregnancy in that. So that's just way too risky. It's not a high success rate. So with that being said, the recommendation is to undergo in vitro fertilization if you have a tubal blockage or tubal interrupted issue. There are people that still do tubal surgeries, but if you had something where you had to pay maybe $10,000 to get maybe a 15% yield, it really doesn't. It's not really advantageous for you when you can pay $20,000 and have a much higher yield with doing IVF. It just risk and benefits. It's just not a big. It's more risk than benefit to that. What's the next question? Vitamin D deficiency. So there are actually some studies. There's a study at the University of Chicago that they're doing right now for primary and secondary fibroid prevention. And I was just looking at this lecture. It's really good work. And what they're looking at is with women that have fibroids, how you can, prevent them from growing, and then women that don't have fibroids, more importantly, how do you prevent fibroids from actually occurring? And the research that they're getting is that for understanding that fibroids are tumors. They're cancers. They're just non-malignant cancers, and they have abnormalities or gene growth abnormalities that are different from other cells that are normal for uterine tissue. And so when you can get an early detection, what they're working on now is an early detection to find women that have these cells in their uterus or these genes in their uterus, and trying to detect how and what things they can use to intervene to prevent fibroids from growing. And vitamin D deficiency is actually one of the more promising things that they found. There are a couple of other supplementations that they found that are advantageous when preventing fibroids. But first, diagnosing women that are going to be prone to growing fibroids is key, which is what they're working on now. But I don't want you to get from that if you have fibroid disease that taking vitamin D is going to make them smaller, or taking vitamin D is now going to make them not grow, which is really not true. It's the research is now showing that trying to detect women that are high prone to growing fibroids in the future, and supplementations that are going to prevent. Green tea is another one. It's green tea, vitamin D, and there was another supplement that they had that they found was preventing it. But it's really groundbreaking research. It's awesome. So the more I learn about it, the more I'll share. Because at the end of the day, if I'm not fibroid slayer and nobody has fibroids, I'm good with that. Then I move on to the next thing. So I don't I don't live off women getting fibroids and we having to operate on them. I'm just doing it to help because it's a problem. But if we can find a cure or find a prevention, I'm all for it. I really, really want that to happen. So I'm a total proponent of that. So anybody watching, don't think that I am praying that women keep getting fibroids. I would prefer not to do these crazy surgeries if I can avoid it, honestly. What else? Appointment stuff is up there. It's common for women to have pelvic pain during a cycle after fibroid removal. Does it resolve with surgery? It really depends on what the pelvic pain was for. So the question is, how often or is it common for a woman to have pelvic pain during a cycle after fibroid removal? Does it resolve with surgery? So that's a great question. And what color don't you?
So
you had your total uterus removed.
yeah,
So
I was gonna say, so I had a hysterectomy,
go ahead. You
I
answer.
did one time wake up with pelvic pain, and I was like, and I'm calling Dr. Johnson today. Something ain't right, but I had a bladder infection, so it was something completely different. But I had definitely was like, hold on, this no, I'm calling, I'm going back, but it was a bladder infection, so you was off the hook.
Thank you. So pelvic
but I woke up in so much pain. I was like, what is going on? So
blame me for everything.
Yeah,
but
you was that one.
Thank So pelvic pain is one of those things that doesn't really have one specific thing. Um, Pelvic pain is can be a byproduct of excessive bleeding in your uterus, to where you bleed so much that your uterus is trying to clamp down to get the blood out. And so if you fix the bleeding aspect of it, the pain is going to get better. Now, with that being said, fibroids don't always cause bleeding. So just removing the fibroids in of themselves doesn't mean you won't still have bad periods. And if that's the case, you're still going to have cramping if you have bad periods and your periods are from cramping, from bleeding. There are other things also too. So women with fibroids also have endometriosis, also have adenomyosis. They have other gynecologic issues that are hormone dependent. So just removing the fibroid doesn't mean that everything else that's dealing with hormones is going to make things better. So don't think that just because you don't have fibroids, that cramping to get better, because they can be persistent. It really just depends on why you're cramping. And for women that keep your uterus and you preserve your uterus, realize that as long as you have a uterus, you have the potential to have problems, right? So if you remove the uterus and remove the fibroids and you keep the uterus, it can still have excessive bleeding. You can still have endometriosis. You can still have adenomyosis. You can still have things that are going to impact you, that are going to cause problems. But the reason you're keeping it is because you typically want to have a baby. For every woman is like, I just want to keep my uterus because this is what God gave me and I want to die with it. Okay, that's fine. You want to take big fibroids out, but you have no intentions on having a baby. You just want to keep your uterus. You got to take everything that comes along with and the responsibilities of having a uterus. So you can't really get mad if that's the case. So just like with everyone, I'm all about preserving the uterus, but preserve the uterus with a purpose. Preserve the uterus if you're going to use it. If you're not going to use it and it's causing you major problems, then you have to put hysterectomy on the table. And hysterectomy, minimally invasive, that is. But you just have to know your options and be realistic about your options.
I also will add on that, however, since I still have my ovaries, I do still get symptoms when I probably would have got a period. So I still experience tender breasts. Sometimes I still have weird cravings, but I kind of eat different anyway. So I usually don't worry about that. But the tenderness of the breast still happens once a month.
Yeah.
For now.
Hormone. Yeah. The ovaries are going to continue to produce hormones. Your body's still going to go like it's having a cycle, but it's not going to have a cycle because hormone levels are going to go up. Hormone levels are going to go down. Your ovaries are still going to ovulate and release eggs. So things are happening physiologically in your body. But it's realize you're still a woman that's producing hormones. You got still there.
I don't deal with swollen feet or bloating anymore, though. My stomach doesn't do that once a month, or my feet don't swell once a month.
So like another one of my patients said, what can you do to tighten the pelvic floor and wall? Kegels. Kegels are great. You can chime in on that, Cola, but I would say definitely do Kegels.
Yeah, I agree with that. I've always done Kegels. I've had 2 children, so I definitely. My doctor was very the doctor that delivered my children was very adamant about the importance of doing Kegel exercises. I didn't tear either, so it must have did something. Well, I had one little, like that phase 1 where it was in the inside, and they were like, we don't know if we even need to stitch it up. But I had 2 babies. Second one, nothing, no stitches at all, and 2 pushes.
Another question. So, how do adenomyosis and endo get diagnosed? That's a great question. So adenomyosis is really a diagnosis of exclusion. It's not really. No, I'll take that back. it's one of those things that you can't really officially diagnose until you actually remove the uterus. Put it that way. So adenomyosis is a disorder in which the lining of the uterus actually grows into the muscle of the uterus. So you have, just abnormal cells growing in the muscle. It is extremely painful. It can cause excessive bleeding, but there's no true diagnosis. You can't get a biopsy. You can see on the ultrasound and MRIs cells that look different, that look very, very um, uh, indicative of adenomyosis. You can look at the uterus, and if the uterus has like a globular appearance, I've done so many hysterectomies and done so many, fibroid surgeries. I know what it kind of looks like, but the true diagnosis of it you can only get by removing the uterus. In short, endometriosis is different. Endometriosis is when the lining of the uterus actually grows into, or the endometrium grows into the actual cavity, or in different spots on the inside of your belly. And for that, you can diagnose it one of two ways. One way, you can diagnose it by just with trials of hormone suppressants. So hormone suppressants, or endometriosis rather, let me back up. Endometriosis is dependent on hormones that your ovaries produce. So if you give medications that cut off the hormone or significantly decrease the hormone production of the ovaries, then your pain gets better, then that's pretty indicative that a person has endometriosis. If the pain is persistent, it does not necessarily mean that they don't have endometriosis. It may mean to the point that they have very, very bad case of endo, or they may need more medication or stronger medications to really shut the ovaries down. To see, when you shut the ovaries down, you stop the ovaries from producing hormones, endometriosis should get better. That's one way of diagnosis. The other diagnosis is actual visualization. So doing a laparoscopic surgery, small incisions, putting a camera in the belly, you can see the lesions sometimes. Like those lesions or implants look like little chocolate dots or cysts that are implanted on the peritoneum or the lining of the belly. And you can actually see those. So that's another way of diagnosis. So diagnosis by trial of medications, or diagnosis by actual straight visualization. So those are the two things. That's
All right.
if I get to, like, I try sometimes, like sometimes it's hard to like break things down in like layman terms. And sometimes I might start talking like too doctorish. And if I do that and I'm doing that too much, like stop me and tell me, like, break that down some more. Cause sometimes I don't know I'm doing it. I'm trying to like spoon feed it, not spoon feed it, but making it like dumb it down as much as I possibly can so that people can understand it. So I'm not talking over anybody. But if I am doing that, just type in and just be like, yo, explain that again, or like make it more understandable, and I will.
All right. Somebody said, how often and for how many minutes a day should you be doing Kegels?
How strong you want your vagina? You want to be able to toss a quarter to the other side of the room?
Out of control.
I'm just saying, like, what you trying to do? You trying to have like stripper level control, or you just trying to have like a little something extra in the bedroom? It depends on what you want to do. It's like, I want to be, kind of swole, but I don't want to be, straight bodybuilder swole. I don't have time for it. So, I do enough lifting, working out, whatever, so I can look good. But if I want to be in there and, look like Lou Ferrigno, look like, some crazy wrestler or something, then I'm gonna have to quit medicine and just work out all day. You can be in Kegels, doing Kegels for hours and hours a day and have like super tight vagina, or you could just do it, 10, 15 minutes a day and get the job done. It just kind of really depends on what your goals are. Yeah,
It
that's
makes
how.
sense.
That's how I feel about it.
Do for selling the mold of it. That's how you got to look at it. Right. I got the next one. What are the risks of getting pregnant with fibroids?
Um, so when I preface this, like when I talk about stuff, like we have to be very careful about putting everything in an umbrella, right? Because fibroids do not impact everybody the same, right? There are big fibroids, there are smaller fibroids. There are fibroids that are in the cavity of the uterus. There are fibroids that are not. Like fibroids, just because you have fibroids doesn't mean anything significant unless it's causing you problems, right? Unless you know you have them. Because many women have fibroids and have absolutely no idea. If you don't know you have fibroids, you don't need to know you have fibroids. So I've done many C-sections, deliveries on women with fibroids that have had no problems whatsoever. They haven't had problems getting pregnant. They haven't had problems keeping a pregnancy. They haven't had problems with delivery because their fibroids were small or in the external part of the uterus, sometimes even big, but they're not really pushing into the cavity of the uterus and never have any problems. So for those women, there's really not any risk at all. For other women that have fibroids pushing into the cavity of the uterus or have excessively large fibroids that are going to make a mass or size problem the bigger the baby gets, where they don't have enough space in their belly to accommodate this big ass fibroid and then this big ass baby, and they're fighting in your belly and you just don't have enough room. That can cause a problem. So it really depends on a case by case basis as far as like what your fibroids look like and where they're at, as far as will it be a problem with pregnancy. So that's a tough question to ask, and it's really like case by case specific. I never would want to say that, oh damn, if you got fibroids it's going to do this. Well, if you got fibroids and you get pregnant, it's going to be that, because there is no one answer for it. You can't say that.
All right. Dr. P, how can we send you a gift?
No, says me never. No, like, you know, I appreciate any and everything anybody ever does for me. Like I send it to Cola. Like if you want to send me like Cash App, or you want to send me, or you want to mail something to my office, you want to do anything like that, that's perfectly fine. It's cool. But I don't solicit that. I don't get on here to be like, yo, everybody like send me this, or I don't say, oh, I don't make that much money off surgery, so anybody could feel sorry for me to send me money or whatever. Like that's not what I'm doing it for. So if you feel compelled to do it, like y'all can reach out to Cola, and Cola will give you like my Cash App and give you all my information. But I'm not going to personally just put it up there, because I don't want anybody to ever be like, man, this dude just out here trying to get money, whatever, because that's just not me. And anybody that knows me knows that I'm not doing it, because for real, I really need to start taxing y'all ass, for real. I'll be in there, and listen, I'll be in that boy for like 6 hours on surgery. I'm like,
Why you
man,
gotta get my surgery time?
listen,
Why
I'm
you gotta
like,
get my
Paul,
surgery
I
time?
ain't talking about you. Like it's worse cases than you. It's
Okay.
worse cases than you.
Just
Like,
put that out there. Just put that out there.
yo, I'm like, hold up, pause. Like, if somebody looks and sees what I'm actually doing and sees like the amount of like energy and effort and anguish and shit, not just doing the surgery, but after, checking up, post-op, doing FMLA, getting shit settled, checking on patients or whatever, and you actually saw what I actually got for it, you be like, yo, you crazy. Like, I'm keeping my regular job. Like, it is not okay. It sucks. And
By the
then
hours, by the money, it's
and then
you back
I be
at
going, I'll be
850 an
going,
hour.
yeah, I'll be like, yo, I'll be going to dinner, like everybody get tips. You tip for dinner, you tip the Uber driver, you tip. No, I haven't tipped you shit. You know what I mean? It don't matter. I'll be at work.
We got a tip
I'm
for
not
you,
getting
all
tipped.
right.
I think about it, but I'm never going to let that just like take over my brain. But I'll be like, what are you doing? But you know, it is what it is. Like I talk to God about it all day. It is what it is. If you know, my gifts come in other ways. So people give to me, it's cool. But you know, whatever I get, it is what it is. I make my money in other ways. Call it a day.
That's what's up. All right, I got another submitted one. I started having symptoms of menopause and my cycle was only coming every now and then. I went to a hormone specialist doctor, and she prescribed a natural hormone cream that I would get right in her office. It helped tremendously, and they put capital letters, with eliminating hot flashes and vaginal dryness. I even slept better and had more energy. One side effect, though, is my cycle returned monthly and sometimes even lasted a couple of weeks. I asked my doctor about it, and she wanted to try all types of things, but the hormone doctor suggested maybe just an ablation would be a good help. What is your opinion on ablation?
How old is she?
She just said I started having symptoms of menopause.
You got to be careful. I try. I got to be. I'm just real careful about how I speak about um just for like how other people prescribe medications and do stuff. I would just say be very careful. In direct answer to your question, as far as ablation, I am a total proponent of ablation. I've done two. I just did two ablations today for women that really needed ablation that did not need hysterectomy. If you don't have bad fibroid disease and you have, just either bleeding from perimenopause or this abnormal uterine bleeding that's unassociated with fibroids and any other masses, I wholeheartedly endorse endometrial ablations. It's a great treatment tool for abnormal uterine bleeding. Um, yeah, I really, really, really support it. But be very careful about hormone replacement and stuff like that. There are risks associated to everything that you do. Understand those risks and be really aware about your choices, your options, and what the risk of things are. I'll just say that and leave that there.
All right. How many in practice, how have you seen the GLP-1 medications affect your patients' menstrual cycles? All of my patients are using for weight loss.
The which one? The what you say?
It says in practice, how have you seen the GLP-1
Oh,
medications?
like Ozempic and all of those, like the diabetes medications and stuff. I have not really seen it impact. I haven't had a wave of patients with like menstrual issues from that. With that being said, my practice has really kind of took a nose dive into fibroids and stuff since I've made that my niche. Like I've really, most of everything I see is fibroids now. So women are not as focused on weight loss, but more how to fix their fibroids or their bleeding. So in fairness, I can't really speak on as much with my experience in my patient population just because I don't have, I guess, an overwhelming majority of people that are taking these newer medications for weight loss. So I can't really speak on it. As far as my practice is concerned, I'm not seeing a big problem with menstrual cycles, from those. I will say I think that these medications are getting overly used, though, and I think that there's going to be some problems down the line because when we start taking medications for what they're not really intended for, then we're gonna have some problems. And that's kind of preliminary with it. And I say that to everybody, like just really be cautious about what you're putting in your body. Like diet and exercise works. Like if you really steadfast with it, it works. Like, you know, give yourself a chance to do things normally. Don't try to do the quick way, quick fix, put medication. Hell, you saw everybody was all gun ho about the damn COVID vaccine and any like getting the jab and all this other shit. Like you really don't want, like, I can't take medication, whatever. But if it's a weight loss medication, give me that shit. I want that. Phentermine, freaking Ozempic, give me all that. I want it all. But like, don't keep that same energy for all medications. Like, don't be like, I don't want, this, and I can't do that, and I can't take this, and I'm not good medications, but they got a weight loss medication. I'll take that. Like, keep that same energy. It's just crazy how people will change their thought process for stuff that they really, really want. But I say, if you can do things naturally or what have you, just take the time and invest the time in yourself and in your health to do it, and don't have to take a bunch of medication. This is from a doctor, and everybody like, oh, the pharmaceutical companies pay you, or you get paid for surgeries or whatever. I don't. Every patient I talk to that comes to me, I am endorsing healthy diet, healthy lifestyle. If there are herbal supplements or what have you that can fix the issue, absolutely. I don't want to operate on people unnecessarily, or do I want people taking medications unnecessarily? So if there are things that are there that can fix it naturally, absolutely. Healthy diet, healthy life, 100%. Surgery and medicines are reserved for people that actually need them. So, let them be reserved for that.
All right. Is it common to shrink in height during menopause? And if so, what would cause that?
Yes. Yes, it does. And this is from the lack of estrogen production, which plays a role on your bone and bone mineral loss, which causes some reduction of bones, and also like slumping over a little bit. So bones and muscles start to kind of, not so shrink, but age or atrophy. So yeah, my mama, even though she has not like shrunk at all or what have you, she's just short. She swears she getting smaller or what have you now, but it's probably going to come. But yes, it does happen. It's not like you're gonna go from 5'9" to 5'1", but 1 to 2, maybe even 3 inches in some extreme cases for women that have significant osteoporosis and are hunched, can lose, some height just from atrophy of bones and tissue.
I don't need to lose another inch in height. I'm short too. I'm not looking forward to that part. All right. What is a vulva exam?
A vulva exam?
That's what it say. VLUVA, right?
Yeah.
That's vulva.
Your vulva is if you look at your vagina, do I have?
Well, somebody lied to this person.
Hey.
You need that exam.
A dude was like, hey, let me give you this vulva exam and check it. The vulva is like the external part. So that's right. So it's like the vulva is like the most external part of your genitalia, right? So you got vagina on the inside, labia minora, labia majora, and then that outer part, this everything, the fufa, or the the thing that you see, that's vulva. You would inspect the vulva for lesions or sores or things like that if you're looking for like herpes or sores or things like that. But that's just with a regular genital exam. Nobody ever comes to me and I say, hey, let me do a vulva exam, unless they say, oh, I have a sore on my vulva or a problem with my vulva. Then I'll look at it in particularly. But it's part of the looking at the genitalia, making sure externally you're good, internally you're good. It's just all part of the same process.
All right. How is the process going for persons outside the U.S. who would like to do their surgery?
It's actually going pretty good. I've been trying to work with people because I have some patients in the UK, some in Canada, St. Martin. Like some patients in Africa that are trying to come over. One, it's automatically going to be reduced, but I'm trying to work significantly on a program that's going to make this much more affordable for patients that are coming out of the country. So it's just a process of calling my office and trying to work to get pricing. You know, I work for or I'm contracted by a nonprofit hospital, you know, that is there for the community. So, you know, they are definitely trying to work and make it possible so that I can operate on everybody, which is why I love it. You know, so it's just a process of calling and trying to figure out what those numbers look like and trying to get the best price for you to come and have surgery.
All right. So how are we looking on time? Because I know you.
Um, I'm good. I guess we could start with like 8:30. It's like 8:13 right now.
Okay. And then do you have any requests for anybody that wants to join in person?
Everybody being chicken shit today. Nobody wants to hop on here on this live to tell me about their life.
So no requests?
No free consults today. I don't know. Somebody hop in at the very
Yep.
end.
That's how it always happens. All right. All right. This is a weight loss one actually. So I gained almost 40 pounds after being diagnosed with fibroids. Now that they are gone, will it be easier to lose weight? I saw in a previous video, Cola said she lost 17 pounds in 2 weeks. So I can answer it because it's a difference between your weight loss and you eating healthy and somebody who actually lost a big amount of weight. Maintenance is hard too, though. I will say that. So I don't think I lost 17 pounds in 2 weeks just because I lost a fibroid. Removing the fibroids made it easier to lose weight with no action. So I'm gonna be clear. So before I had fibroid surgery, I had did a big change in my eating habits, my lifestyle, and things like that because I actually thought that I was causing my problem. So before I even knew I had fibroids, I thought that I was causing the heavy bleeding, which was partially true because when you hold more fat, you do have more estrogen. So that's probably why my periods were heavier. But the bigger problem was the fibroids. So prior to me getting fibroid surgery, I had naturally lost 85 pounds. And when I say naturally, I didn't have a surgery to do it. There, you still take supplements, protein shakes when you're eating right. I mean, you take vitamins, stuff like that. But I mean, no, I didn't have any surgical procedures to lose the weight. So I feel like the reason I lost 17 pounds in 2 weeks was probably because I didn't have much of an appetite right after surgery. And I probably did lose like extra water weight, extra bloating, stuff that I was retaining from having that big mass. As Dr. Johnson describes, it has a lot of blood flow going to it and, utilizing resources of my body. I will say that I personally took about a 2-year hiatus because I've been having so much fun not having fibroids that I've only maintained weight loss during this. So like some weeks it was like 20 pounds, some weeks it was 15. So I was going back and forth between 20 pounds and 15 pounds lost post surgery. Since then, though, I've been a lot more self-conscious again of how I eat, how much activity I'm getting, and making sure that the things that I was doing to get the 85 pounds off, that I keep doing them to get more off. So I've actually gotten back under my pre-COVID weight. But so I'm finally back under my pre-COVID weight. But I will say this just for advice as far as losing weight. I don't care what diet you pick, you have to eat at a calorie deficit. So you have to know how much you're taking in and how much you're exerting out. And I didn't go to school for that, but I definitely watched a lot of YouTube and I did my own calculations.
Nice.
And that is proven that if you're eating at a calorie deficit, you will lose weight. So I don't care what diet you pick. I'm not going to say one is better than the other, whatever. I try to eat as clean as possible. I mean, I still like pizza is one of my favorite foods, so that's probably my weakness, and chips from Chipotle. Those are my two weakest things. So those are the things that I try to stay away from on a regular basis because they're my weakness. But I try to eat as clean as possible. I definitely make sure I have water. So like if I'm not doing a half a gallon, I'm doing a gallon a day. period. Like I never go below a half a gallon, and portion control is very important. Now, I am not a person that loves the gym. I am not Dr. Johnson on when it comes to activity, but I do love to dance. I like to roller skate. I do like to lift weights. So you have to incorporate things that you don't mind doing, because then that way it doesn't feel like a chore, if that makes sense. So on my lunch break, I do little things in the house with kettlebells, hand weights, resistance bands, and I do it to music. So it's fun, especially some of my favorite songs that if I was in the club, I wouldn't be sitting down. So I just do that at home. And that's how I make sure it's regular, if that makes sense. But calorie deficit, definitely knowing portions, and definitely you have to have some activity. You don't have to be a bodybuilder, but you have to have some type of activity, period.
And so what she just said was your fibroids are not in there with a fork and a knife eating up all your.
I didn't say it like that.
I'm just saying what you're trying to say. Hey, y'all,
you said it like a guy.
I'm just saying, listen, because I got women that come in here talking about these fibroids. They just making me gain weight, and they consume my life, and they just, they putting on 40 pounds since I got diagnosed with fibroids. Listen, fibroids can do a lot of things. They are not going to store calories for you, right? It is diet and exercise. Just because you have fibroid surgery or you don't have fibroid surgery, or if you have fibroids or if you don't have fibroids, all of those things are negligible. Now, what fibroids can do is if you have excessive bleeding or pain and you don't feel like being active and you are more sedentary, and you are eating because you're more sedentary, it can make you gain weight that way. But they're not going to. Gaining weight comes from eating in inactivity, right? If you eat properly, you exercise, you diet right, weight's going to come off. I've said this multiple times about calorie deficit. I promise I had a whole big spiel about calorie deficits in there. It's like it's like your gas tank. If you put a full tank of gas in your car, if you drive a tank and a half, guess what? Your car gonna break down. Same way with your body. The difference is there are reserve gas tanks in your body called fat. That's what it starts to chew if you utilize all your gas. So if you put this amount of food in your body and you take up more than what you're putting in, it has to start chewing the fat. It's you cannot add more. You can't add if you're not putting enough in to add with. If your deficit at the end of the day, if you have a deficit at the end of the week, at the end of the month, at the end, and it completely piles up and piles up and piles up. If your deficit continues to grow, it has to start to make you lose weight and chew fat. Just a fact of life. So what she said is 100% accurate. I won't belabor the point, but like she's saying, very, very factual things that you guys need to listen to.
Yeah, and I also will just add on to when you're learning how to eat better, and or educating yourself on how to eat better, don't just compare yourself to maybe somebody else or whatever. You really do have to learn your own body, because I feel like there are certain things about me that I've learned in this journey that I stay away from, just period. Like I don't even go around it because it just doesn't work well with my body. And I also feel like all of the substitute stuff that they put out there for me is worse than if I just try to eat basic and simple. So to me, it gets too complicated when you're trying to substitute. Just keep it simple, like straight vegetables, straight, if you eat meat, straight protein. Like just keep it simple. Like you stress yourself out trying to figure out how to go around or how to create something when you're trying to avoid it, if that makes sense. So just keep it simple and clean.
So, are there any feet issues when going through menopause? I don't know specifically what that question is. Feet as in painful feet or ugly feet? I don't know. I don't get that one. You gotta be more specific with that. But as far as like pain or anything else like associated with menopause and feet, no. Um, Shave or not shave the vagina and pros and cons. It's preference. I would say that if you're going to, because I hate body hair myself, and if you are going to, as a woman, want to eliminate body hair, then waxing is better than shaving. Because shaving, when you shave, you you can cause microabrasions of the skin, and when those microabrasions can increase the risk of ingrown hairs or abnormal hair growth. So if you have a propensity for ingrown hairs, it's going to come out with shaving. So if you're going to do anything, waxing or laser hair removal is going to be better than shaving. But if you're asking to shave or not to shave, I can speak for probably 95% of all men. Yes, please do so. It is something that we enjoy. Moving
You got the next one?
on. Yeah, I can. Let me do that. At 45, is a hysterectomy good to do? I'm not planning on having any kids, or do I need some of my parts to be balanced? No. If It doesn't really matter how old you are. If you're done having kids and your uterus is a problem, meaning excessive bleeding from fibroids, pain, or what have you, hysterectomy is an option. It really kind of just depends on case by case. Sometimes you may not need a hysterectomy. If you just having bleeding and you don't have fibroids, you may be a good candidate for an ablation. But if you have fibroids or what have you, and bleeding is a problem, you don't want to take any chances of doing anything else, they fail or what have you, and you are done having kids, hysterectomy is definitely an option. And no, it's not balancing anything. The only purpose of your uterus, I'm going to say this again, the only purpose of your uterus is to get pregnant, have children. That is all it's for. It is not to keep you clean. I hear women all the time, well, I'm not going to be a woman anymore. I lose my uterus. God gave it to me. I got to die with it. And it cleans you out every month. That's the biggest myth in the world about you have a period because it got to clean you out. That is false, false, and more false. My question to every woman that believes your period cleanses your body, my question will be, well, are women in menopause dirty now? Since they don't
Or
have,
people that have
or
hysterectomy?
people have hysterectomies, like, are they dirty now? No. The answer to that is emphatically no. Your period is simply to get ready for pregnancy and to get your body ready to implant a fertilized egg. That is what it's for. Other than that, it is nothing else, right? If you don't have one, it's
You won't
perfect.
miss it.
You will not miss it. And that's only if you don't want to have one.
Right. Yeah. If you want it, then. But if you
Want
don't want it, you won't miss
go
it.
to the grave with it.
Especially if you had a horrible one and you coming off of not having one.
I think that was it.
You got everything in there?
I think so. Yeah, I think that was it. I think. Unless you have something else.
Yeah, I got. Well, it's not on. I got two things going because people submitted stuff too. Well, it's 8:26, so no request to join, right?
Nope.
Okay. No, I'll ask this one. What do you think about women getting pregnant at 45 years old? What do you think about the safety and egg quality? Is it true? Is there a true age where women should stop trying to have kids?
That's a tough question. If you have the ability to have children, if you have the egg quality to do so, no, I don't think that you should be able to, you should have to stop. I think naturally your body will stop you from having children. Now realize that the older you get, the higher the risk of complications, the higher the risk of fetal anomalies and abnormalities. But with that being said, I've delivered 45, 46, 47, 48-year-old women that have had healthy pregnancies, healthy babies. So nobody should ever say that you are 45 and you should not have a baby because you're too old. That's crazy. If you can, you have the ability to do it, do it. If you want to go and pay for in vitro fertilization or fertility treatment, and you have the resource to do it, do it. You know, everything is associated with risk in life. You know, it's a risk that you can get in your car and you might not make it to your destination. It's an extremely small risk. That's why we hop in our car and go where we go. But there's still a risk associated with it. So it's, yes, is there a risk associated with you getting pregnant at 45 and having complications and issues? Absolutely. It's still a relatively small risk when you look at it, and it really comes down to what you want. So there's not anything that I would say age wise where you couldn't. I would say for your body, what it is. If you have horrible medical issues, you're not in good condition, and if pregnancy is going to be a significant hindrance to your overall health and the health of your unborn child, then yeah, you may be too old. Or if you don't have the air quality, you have diminished air quality, and you're spending tens of thousands of dollars to try to get pregnant, and it does not have, you know, viable chances of coming to fruition, then yes, it may be time that you know, kind of throw in the towel with that. But if all of those things are not true and you have the ability to do such, then absolutely, you know, there's no age. I don't have a cutoff for women wanting to get pregnant. I have women right now that's coming in 47, 48, want surgery, want to do everything to have babies, and I do surgery on them because they have a plan to get pregnant. Just have a plan. If you got a plan, God bless you. Go get it done.
All right. So I think you got everything in the bubble. I mean, my list is super long, so we can always go come back. But
Sure.
it is 8:30, and I don't
Yeah.
want us to get thrown off the ground.
So the last question is: are there tests to test egg quality? Yes. Anti-malarian hormone, or AMH, is a blood test that is a very good indicator for where your air quality is at. That will be the first test that you would get to see where your air quality is at. And in addition to FSH, or follicular stimulating hormone, as well as estradiol, which are three of the tests that I normally get for looking for their fertility options. So those three tests, absolutely. Um, but yeah, so that's it.
That's it.
That's it. So um, until next time, I guess we can do this in a couple weeks. We don't have to wait a month.
Yeah, I know. It's just the last 3 weeks have been
Oh, I've been crazy.
completely
It's been,
insane. I was telling you a little bit about how my schedule been lately. It's just been insane. And people was DMing me like, when is the next one? I'm like, I haven't even planned it. I'm sorry.
yeah.
Y'all. We definitely gonna always do once
Yeah.
a month, but sometimes doubling up in a month, it was real hectic.
Tough.
Yeah.
Yeah, for sure.
So,
I need to get back active. I've been to show you how busy I ain't been posting and I ain't been doing nothing. I've just been working.
yeah, I didn't miss a lot of happy birthdays to people because I have not been even online. But I've been trying to like I said, I've been still writing down the questions. So that's why I said my list will always be full. So we haven't ran out of that kind of content. But
What about the baby girl question? Who was that?
oh, I'm sorry. If did you put it in the bubble? Because everything in the bubble.
My cycle stopped at 36 and I'm had a hysterectomy at 41. Will I possibly need hormone replacement? That's something we have to look at. There's multiple questions I would have to ask from that. I have to ask some questions. So please save that so we can talk about that next time, or you can even hit me offline and I can kind of go into that one. But it's other questions that I would have to ask you for that. That's just not just like a straightforward one. I think that was the last one though.
I'm just looking. Desi said she put something in the chat bubble. Sorry, let me just look. Did you put it in the question mark with the question around it, or you just put it on the screen?
Nice. What she said?
She'll save it. Okay.
Yeah, save.
Okay. No problem. Yeah, because I didn't see it. Or just send it to me after this, and I'll put you'll jump the line for next time. Okay. Yeah. DM me afterwards.
All right, beautiful people.
All right. Well, as always, Dr. Johnson, we really do appreciate you and your mission, and I'm glad that you are being challenged to the fullest extent.
Yes,
I'm happy that, but you remember how sad you were looking when you couldn't operate?
Yeah.
Do you? Well, you might not remember. We remember how sad you was looking when you couldn't operate. You glow every time you come on now.
It's good.
Now,
but
you might not be glowing when you in that actual room.
Right.
But when you talk, you are glowing.
The gift and the curse.
I like the surgery given, Doc P.
Good with it. Y'all keep coming. Keep bringing me this crazy shit out here. That's fine. I'm built for
it. Reshare. I will always put it also on YouTube if you want to share it with someone who does not have social media. I am Cola Red Bell on every social media site that I participate in. So my name is consistent. You will be able to find me either way.
The same. So y'all keep tuning in. Copper IUD or hormonal. That's another question. We'll get into IUDs and preference about that. Yeah, we'll talk about that with the next one. We running out of time. That's an hour and a half. So we'll talk to you guys later. I'm gonna post this so anybody didn't see it and want to look at it or what have you, it's always on my page too, and it's on Cola's stuff as well too. So,
yeah.
All right, talk to you later.
All right, take it easy.
All right.
Peace.